Good morning, everybody. My name is Mandy Polonsky. I am the Director of External Partnerships and the Academy at Northwestern Medicine. We are thrilled to have you here on behalf of the steering committee. Thank you to April for everything you do and for putting all this together and gathering us. If you haven't had a chance already, please put your name and role and where you work in the chat. We're happy to see you all Sunday morning. So for those of you that are new, just a little refresher on the mission of the Chicagoland Healthcare Workforce Collaborative, or it's nice to see it spelled out because sometimes when I say CHWC, I get a little tripped up. We are uniting employers and industry partners to support an inclusive healthcare workforce to provide accessibility for unemployed and underemployed populations, and develop innovative responses to the evolving needs of the healthcare industry. Focused on local and targeted hiring, education and training, and retention and career pathways, and we'll talk about a little bit of each of those today. These are our ever-growing list. This is our ever-growing list of partners. These are the employer partners, but then there's many strategic partners who we're grateful for, education partners, other industry partners that all help us work together better.
Your audio is a little wonky, Mandy.
No, okay.
Sometimes it's better and sometimes it's worse. I think we're generally. But
Then why don't you take over?
Sure. Thank you so much, Mandy. Much appreciated. Good morning, everyone. I'm April Harrington, the project manager of the Chicagoland Healthcare Workforce Collaborative. Here's our agenda for the day. We're going to start off with reflection and planning. We will celebrate our accomplishments over the past year, talk about our strategic priorities for 2024, and there will be time in this first hour for mini breakout rooms for you to do some networking and peer learning and share your ideas for CHWC in 2024. So get ready for that interaction. Then we'll have a brief update from our Youth Pathways Committee, and then we will spend some time getting updates on our Good Jobs Challenge. Sasha Ongtenko will talk about updates just about the Certified Nursing Assistant Pathway Hub, which is the model that we are working on with our Good Jobs Challenge grant funding. And we'll also hear a special overview of Rush's program. They are doing an apprenticeship model for their PCTs, and they're also doing a pathway program that upskills PCTs to become associate's degree nurses, and then after that to become bachelor's degree nurses. So that's very exciting. And then, as always, at the very end of the meeting, we'll have about 5, maybe 10 minutes for community announcements. So if you have anything you would like to share with the group, you can do it then. There are a lot of updates we're going to run through relatively quickly. So please feel free to put your questions in the chat. We might not have an opportunity to invite everyone to come off mute and ask questions after every bit of updates. So please use that chat, and you're always welcome to email me later on with more questions. So first, let's celebrate a great year. I am pleased to share that we have our first cohort of certified nursing assistants who are going through a program that is funded by the Good Jobs Challenge, which we were awarded over a year ago, but it's taken some time to plan. That's very exciting, and you'll hear more about it later. We also finished some research that we had been working on for a while. The research report titled, "What Opportunities? Understanding Committed Frontline Healthcare Workers' Perceptions of Career Advancement Opportunities," which was conducted by the Workforce and Organizational Research Center, headed by Ellen Frank Miller. That was released earlier this year. If you haven't had an opportunity to check it out yet, I highly recommend that you do. I'm going to drop it in the chat right now. And for those of you who were a part of the learning event where we first rolled out that research, check this link out. It is a slightly updated version of the report that includes some more demographic information. So that's exciting that we finished that. Our steering committee hosted 4 learning events to share their models and their best practices and to have conversations about workforce strategies. Our Youth Pathways Committee hosted 2 virtual events for high school students, reaching over 200 youth. And they also were able to grow the Area Health Education Center Speakers Bureau from 36 to 50 active healthcare professionals in a Speakers Bureau. We launched a new website. Again, if you haven't checked that out, I encourage you to. I'm going to drop just a regular link into the chat. There are tons of great resources that I've brought together in that space. And there's lots of great information about CHWC. So tomorrow, if you're looking for this recording or the slides from this meeting, just go to the website and you can easily find them there. If you're ever wondering when the next meeting is, go to the website and you should be able to find it there. Also, if you are not getting our monthly newsletters, I encourage you to go to the website and right at the bottom, there's an easy sign up for our newsletters. So we did a website, yay. And finally, we strengthened our connection with Senator Durbin's office and the HEAL initiative. That is the Hospital Engagement Action and Leadership Initiative. It is a multi-pronged approach to address violence in our city. And one of those approaches is workforce development. So we've been coordinating with their office, and we'll be meeting with them early next year to see if we might be able to get some congressionally directed funding to expand our work. So just a few of our accomplishments together. Thank you all for being a part of it. Couldn't have done it without you. In addition to everything that we've accomplished, there's also been a lot of organizational change over the past year. And I know that some people have been confused about what's this meeting, what's that meeting, where should I be? So I thought it might be helpful to put together a little infographic. It's a little wonky, but I hope it helps demonstrate where CHWC sits in a larger ecosystem and where you might be able to plug in. So Health and Medicine Policy Research Group is the organization that CHWC now sits under. We used to be just a project of the Funder Alliance, the Chicagoland Workforce Funder Alliance. The Funder Alliance is still involved, but we have a more permanent home under Health and Medicine Policy Research Group. They also host the Public Health Workforce Collaborative. I know that logo is a little hard to see, but that's a Public Health Workforce Collaborative that is run by Anna Yankolev, who I believe is on the call. We are both under the Good Jobs Challenge grant. We're both receiving funding through that grant, and Health and Medicine is the leader of the health sector on the Good Jobs Challenge grant. So while CHWC is working on our CNA pipeline and pathway hub, which you'll learn more about in a moment, the Public Health Workforce Collaborative is working on public health training programs in roles like community health workers, reproductive health workers, behavioral health, and crisis response. Anna, if you would like to throw your email in the chat, and perhaps the next Public Health Workforce Collaborative meeting, which I believe is later this week, feel free to reach out to Anna for more information about that. I've included on the slide. And then finally, our Youth Pathways Committee. This is a committee that was launched out of CHWC a little over 2 years ago. It is now going to be a joint committee of CHWC and the Public Health Workforce Collaborative, and a relatively new employee at Health and Medicine Policy Research Group, Matt McClintock, is going to take it over. You're going to hear more from him and more about the Youth Pathways Committee later on in the meeting. But I hope this infographic helps explain where the connections lie between all these tables and where you might be able to plug in. I will continue to lead CHWC for the foreseeable future in partnership with our steering committee. So our steering committee at CHWC consists of 6 representatives of our hospitals because we are an employer-led collaborative. So our hospitals are leading at the steering committee. And I just wanted to take a moment to announce one quick change with a representative from Lurie Children's Hospital. Eileen Boyle was working with us for about a year and made many fantastic contributions. I know she's not going to be uninvolved anymore. Thank you so much, Eileen, for your service. I'm not sure if she's on right now. But I want to welcome Tasha Gill, who is the Associate Director of Diversity and Workforce Initiatives, as our newest steering committee member, who's already been active in our last few meetings and retreat. Welcome, Tasha. Would you like to say just a couple words?
Thank you, April. I'm excited to be part of the steering committee, and I look forward to seeing what we're able to accomplish in 2024. So thank you for the warm welcome.
Thanks, Tasha. With that, I'm going to pass it off to another steering committee member to talk about the work that the steering committee has done over the past month or so. We had a retreat in November and a follow-up meeting earlier this month to reflect on our past year and our past several years, really, and think about where we want to be 5 years from now and what we want to prioritize in 2024 in order to get a little bit closer to that vision. So with that, I'm going to pass it off to Susan Plattner, who is the Manager of Diversity, Equity, and Inclusion at the newly named Endeavor Health, formerly North Shore Edward Elmhurst, to talk about that. Susan?
Thanks, April. Hi, everybody. So like April said, we had a retreat about a month ago and spent a lot of time really discussing where we wanted to see ourselves in 5 years. And so the 5-year vision that we came up with during our planning meeting was that CHWC is a healthcare workforce development think tank led by exceptional healthcare leaders with experience in health equity, workforce development, community engagement, and diversity, equity, and inclusion. We also want to be recognized locally and nationally as an exemplary model of peer learning and collective problem solving. And so we really wanted to focus on that think tank perspective of not being necessarily the people doing the work, really thinking through supporting one another as a collaborative and helping each other problem solve. Next slide. The strategic plan priorities that we came up with for the year start off with facilitating peer learning and fostering connections. We want to host 6 learning events on various topics that are important to all of us as a larger collaborative. We want to provide in-person networking opportunities, and we also want to have the opportunity to connect employer partners with our workforce partners and workforce opportunities. We also want to have a bigger visibility and build a better reputation, not even better, but build our reputation externally of the collaborative through LinkedIn and having a LinkedIn presence. We also want to make sure that the newsletter that goes out, it goes out to a larger group. We want to be able to collectively leverage our collective voice in exploring policy solutions, cultivating relationships with our local legislators, and of course, utilizing our collective voice to advocate for policy solutions. And then lastly, we want to make sure we're supporting efforts to fund workforce projects. So coordinating collaborative funding applications, hosting peer learning events where we can share funding challenges and funding opportunities. And then the projects that we discussed focusing on will continue to be the Youth Pathways Committee. So operating that committee as a joint committee of CHWC and the Public Health Workforce Collaborative. Continue to build and adopt a clear mission, vision, and goals. And then the Good Jobs Challenge. So the commitment is to train 300 individuals between 2024 and 2025. Through the Certified Nursing Assistant Pipeline and Pathway Training Hubs. We've discussed creating a career navigation tool for CNAs and others to explore opportunities for advancement, and also seeking additional funding that will allow us to expand and continue this model. I'm going to turn it back to April to talk through our calendar.
Thank you, Susan. So as you see there, the steering committee has decided to really lean into the peer learning space in CHWC. We see a true value in bringing together folks who are in similar roles, who work, for competing organizations. So this is a unique space where people can build trust and talk about shared opportunities and challenges that you might not be able to do in another setting. So we really wanted to lean into that and to elevate this space for networking and peer learning. And in that spirit, I wanted to start doing that right away in this meeting. So in a moment, I'm going to put you all into mini breakout rooms of about 3 or 4 people, and it'll be 10 minutes. So everyone just round robin, introduce yourself, talk about why you are here. Why do you participate in CHWC? What do you gain from being part of this collaborative? And then what healthcare workforce challenges or opportunities would you like to see CHWC address in a peer learning event next year? And then we will have an opportunity to share some of those after you come out of the breakout rooms. So we'll begin to decide what is going to be the conversation agenda for CHWC in 2024. So let me drop those breakout questions in the chat right now. And then I'm going to open breakout rooms. You have 10 minutes. It should pop up on your screen. And we'll see you back here in a moment. Allison, it looks like you're unassigned somehow. If you'd like to join a breakout room, I can put you in one. But
yes, that would be great.
Yes?
I had to switch computers, so I just logged back in.
Let's see here. Let's go to. Okay, throwing you in one.
Thank you.
Thank you. Hey, Jonna, good to see you.
Hi, April. Nice to see you.
Hi, Mary. Welcome back, everyone. Welcome back. I hope you all got a chance to have some good conversations, maybe meet some new people. I think most everyone is back. All right. Now I am dying to hear what you've talked about. So now we're going to share your ideas for what you would like to hear CHWC address in a peer learning event in 2024 through this AHA Slides tool, which is a nifty tool that Anna recently taught me about. I'm going to drop the link in the chat. You can also scan this QR code to input your idea. Everyone only has one idea to contribute. So each individual, I'm interested in hearing just one idea, one challenge or opportunity that you would like to see CHWC address in the next year. And once we've got some listed here, I'm going to give everyone the opportunity to vote on what what's resonating with you, what you also agree you would like to hear as well. Okay, approaches to diversity, equity, inclusion, and belonging and retention. That sounds amazing. Impact of travel on nursing and techs. Improving wages and working conditions for entry-level healthcare jobs like home health. Excellent. Workforce best practices in other industries. That's interesting. Pathways to nursing for internationally trained medical professionals. Also very interested in that. Healthcare faculty shortages. Yes. Entry-level worker retention. Attracting community members out of high school to workforce development opportunities. In addition to access and pathways at entry levels, what is the business case, incentives, and what incentives and ways? Maybe whys. Creating a pipeline program and strategies to combat challenges. Supporting comprehensive medical assistant externship to employment opportunities. Career track development. These are fantastic ideas. So many of these are resonating with me. As I'm reading these, think about which ones you're enjoying, because you're going to get 3 votes. You can vote for your own as well as 2 others. How employers are upskilling and creating internal career pathways for their employees. I am incredibly interested in that. These are great. Collaborations among employers and workforce development to leverage braided funding efforts. Tricky. I would love to be better at that too. Is everyone able to use this? Does anyone have any questions? Is this working for you? It looks like we're getting a lot in there. But I know we have about 12 people have answered. Anybody else want to get something in there? Helping leaders understand the work around workforce development, commitment, resources, and why this work is so important. Yes, a lot of the challenges we face are internal, right? You could know what you should be working on or what strategy you should implement, but getting the buy-in is very tricky. I'd love to have that conversation. All right, I see more people are typing, so I'll give everyone a couple more minutes. Is anyone still typing in an idea? Last call. I don't think anyone is typing anymore. So, oh, there we go. Addressing the benefits cliff. Yes. Also very challenging, but I would love to have that conversation. For those who may not know, that's for employees who are also enrolled in public benefits and are receiving things like SNAP or TANF, and once they reach a certain wage, they might not actually be making more net because they're losing benefits at the same time. Okay, it looks like we are slowing down, so I am going to open the next round, which is voting. So stay in that app, or go back through the link, and you all have 3 votes. So dole those out however you wish. Vote for your own and vote for 2 others. And whatever subjects have some of the highest votes, we're going to bring those back to our steering committee to see which ones we can insert into our agenda for 2020-24. Oh, pretty good spread so far. Oh, we got upskilling has got 4. Ooh, I love that. Improving wages, getting a lot. DIB and retention is getting quite a few votes. Ooh, access and pathways. The business case for building pathways, advancing, especially Black and brown women to be in leadership. That's getting a lot of votes. I love that. Oh, whoa. Looks like we're definitely doing a career pathways. You know, I love talking about that. Okay, has everyone submitted your votes? Anyone need more time? All right, let's see. Okay, our top winners are how employers are upskilling and creating internal career pathways past entry level for their employees. And I know Susan, pointed this out on the slides. In continuing to pursue the certified nursing assistant pipeline and pathway hub with the Good Jobs Challenge funding, one of my goals that I've wanted to do since I started project managing CHWC is to create something that is employee facing, job seeker facing, that allows them to understand different opportunities to advance. So focusing on a tool that's specifically for the CNAs in that program first, but I'm hoping that what we build can be something much bigger. Creating career pathways and talking about how we bring people through those is definitely something that CHWC has been focusing on and will continue to. So I love seeing that there's so much interest in this topic. Then we have, in addition to access and pathways at entry levels, what is the business case, incentives, and ways in which you can advance people, especially Black and brown women, to be in leadership. Great. I wasn't realizing that you could scroll earlier. That makes a lot more sense to me now. Love that one. And approaches to diversity, equity, inclusion, and belonging and retention. Wonderful. Thank you all for your input here. I am going to stop sharing that. We are going to bring those topics back to the steering committee and also bring them to a event coming up. So we have a couple of things on the calendar to talk about today. One is that the steering committee felt that it was time that we convened just the employers in CHWC again. The last time we did that was 3 years ago. And we did that virtually and did some brainstorming and some talking about our shared challenges. We'd like to do that again and to do it in person. While we, love all of our strategic partners who are at this table, and you are invited to all of our quarterly events and learning events, the steering committee did feel like it is a unique value that peers who are in competing organizations can come to this space and share challenges. So we'd like to do that in an employer-only peer learning and planning event in February. That'll be the morning of February 15th from 8:30 to 10:30 a.m. in person. I believe that will be somewhere in the medical district, perhaps Malcolm X, but I have not reserved that space yet. So you'll get that invite soon. It's going to be very discussion based. So I know a lot of CHWC quarterly meetings and learning events are very presentation heavy. This will be the opposite. It will be lots of room for small group discussion and meeting peers and sharing what you are seeing on the ground, what's working for you and what's not. And that will also help set the 2024 CHWC learning event agenda and refine some of the things that we just talked about today. Then our quarterly meetings are going to be on Tuesday mornings from 8:30 to 10 a.m. as they have been. We have decided that the March meeting will be virtual following that in-person employer meeting in February. The June will be in person to give us in-person networking time. And then the September and December ones, I'd like to get your input as to how often do we want to be in person versus virtual. So with that, one more opportunity for everyone to tell me your thoughts. I'm going to start a poll. Just simple couple questions. How many of our quarterly meetings do you think should be in person? Should all three, June, September, and December, or just two, or just one? And when meeting in person, is the Loop better or the medical district better? So historically, we've met at either Malcolm X or Chicago Community Trust at 33 South State. So let me know what's working well for you. And the dates on the slide right now are not in the calendar on the website yet. They'll be there by the end of this week. You'll get calendar invites. They'll be in the newsletter, but I'll keep them up right now so you can jot them down. Okay, looks like we got pretty good participation in the poll. 5 more seconds for anyone else to add your thoughts. Okay, I am going to end that poll. And it looks like 2 of the 4. So either the September or the December meeting will be in person as well. And it looks like the medical district is more convenient for folks. So I will get in touch with Malcolm X or see what other spaces we can use in the medical district and plan to host those there. So thank you so much for your help making those decisions. Oh, and I never clicked the button that said share the results. As I was talking through it, I thought you could see what I was looking at. But there you are. It looks like we have most voting for 2 out of the 4 are in person, and slightly more prefer the medical district than the Loop. Okay. Back to our slide. Oh, no, they are up. Great. One more event I would like to tell you about is our first learning event of the year. Last year, we had several of our steering committee members host lunch and learns to share some of their innovative strategies and host conversations. And Susan Plattner is going to do that in January. She has a very interesting program called Aspire Evanston that I think is a particularly interesting example of public-private partnerships. So it's with Endeavor Health, formerly North Shore Edward Elmhurst, partnering with the city of Evanston, Evanston Township High School, and the Evanston Work Ethic Program, as well as Oakton College to build this pipeline program. It's led to job shadowing, summer internships, and scholarships. And the presenters there will share how that's been working for them, what's been achieved so far, and plans for the future. I know that that Endeavor is planning to expand that model into additional suburban areas. Susan, do you want to say anything before I
No, I think that the slide covers that. It's been very meaningful and actually very educational to have this opportunity and to have partnered with the city of Evanston. So Jessica and Jeremy will be able to share a little bit more about what the city of Evanston is doing to invest in workforce development, which is a newer division within the city, along with Evanston Township High School investing in workforce development and career pathing for their high school students in preparation for graduation. So some really interesting learnings from partnering with them.
Yes, I'm really excited for it. Thank you, Susan, for putting it together. I just dropped the link in the chat to register. It's also on our website if you'd like to forward that description to anybody else. Chugging right along. It's a packed agenda today, but we are now going to talk about our Youth Pathways Committee. So this is a committee that was formed after a learning event focused on youth career awareness and pathway building in the healthcare space that was hosted in, I believe, August of 21. And during that event, several programs were highlighted. There was conversation around what worked well and what didn't, and then a group conversation about what we could do together. And we decided during that event that there was a need for a repository of all these programs so that we could facilitate cross referrals and have students who perhaps didn't get into one program to show them that there are all these other programs that they could go to, or when a student is finishing a program, show them that there are all these other programs they can go to for their next grade year. And we also wanted to host some events for the students to give them an opportunity to network with each other, with professionals, to participate in professional development courses, and to learn about these programs. So over the last couple of years, we launched a searchable youth pathways directory on our website that at its height had 36 programs listed. That has now been replaced on our new website with the Rapid Illinois, which is a program out of University of Illinois Chicago, out of the School of Public Health. And their inventory lists over 100 programs, so no need to recreate the wheel. But we accomplished that goal to create a directory. We hosted 2 large virtual events for college age students that had exhibitor halls and panel discussions and interactive activities to win prizes. We've also hosted 3 virtual info sessions for high school students. And more recently, we have tried to recruit more speakers into the Healthcare Speakers Bureau that is hosted by Area Health Education Center, and we've been somewhat successful at that. So the group has done a lot over the past couple of years. It has grown. There are several representatives from our hospital systems who take part in that, particularly those the individuals who take part are typically those who run things like summer internships or mentorship programs, school year programs. But over the last couple of years, we've grown to include a lot more representatives from schools and from community organizations that also have an interest in exposing youth to career opportunities in health. So now that CHWC is sitting under Health and Medicine Policy Research Group, now that the Public Health Workforce Collaborative has had a very successful relaunch year and has a lot of engagement, and that we have the Good Jobs Challenge grant, which allows us some funds for capacity building, we have hired Matt McClintock. He is the new Health Workforce Systems Manager at Health and Medicine Policy Research Group, and he's going to take over managing the committee. He was just with the group last week on Tuesday, on December 5th. We had a strategic planning session, and strategic planning is still underway. And so any of you who take part in this work can join. And with that, Matt McClintock, welcome to the team. We're so happy to have you. Would you like to introduce yourself?
Yeah, I would. Thank you so much, April. Hi, everyone. I'm really happy to be here. As April said, my name is Matt McClintock. I use he, him pronouns, and I was recently hired at Health and Medicine Policy Research Group just about a month ago. And yeah, my job title is the Health Workforce Systems Manager. Part of what I'm doing is working closely on our Good Jobs Challenge grant and working on the implementation of that. And so that's keeping me rather busy. However, I am very, very excited to also be managing the Pathways Committee. The reason why I'm so excited about it is because that's what my background is in. I have done a lot of youth outreach in my previous home of Phoenix, Arizona, but that was actually more in the arts space. And so I worked a lot in music education. And so I had a lot of I have a lot of education experience, teaching various classes to really people of all ages. But then additionally, we would do creative youth development, and we would produce community outreach events to get students interested in jazz education and music education and the like. I switched gears a little bit and I moved into working in healthcare, where I actually got frontline experience as a healthcare worker, and that was super valuable to me to gain perspective on challenges in the health workforce area and things like that. So managing the Youth Pathways Committee is really a fitting synthesis of my various work backgrounds and what I've done in the past. So I'm really excited to do that. As April mentioned, we did meet last week and we had a strategic planning session. And here's some of the things that came out of that meeting. I want to mention, not only am I new to this role at Health and Medicine, I'm also relatively new to Chicago. So I just moved here this summer. And so it's really important for me to learn as much as I possibly can about the communities that I'm working with, the challenges that various neighborhoods in Chicago are facing, and really to learn about the health workforce ecosystem at large. And so that's what I'm working to do. But the reason why I brought that up is because it's important for us, or one thing we talked about at the meeting, and it's the last bullet point there, but I'm bringing it up first, is that we do want to center youth voices in what we're doing and the work that we're going to do at the Youth Pathways Committee, so that we can really ascertain the needs of the communities from the source themselves. And so to me, that means creating leadership opportunities, peer mentorship opportunities, and the like. So we'll see where the committee goes from there. But we had a lot of really engaged, really passionate people in the meeting last Tuesday. And so that was awesome. I loved hearing from everyone. And one thing that was pretty much unanimous across the committee was that students need these hands-on, in-person experiences. We want to elevate experiential learning for the youth that we're working with. We decided that is going to be the most impactful way that we can do this work. Additionally, we want to make these opportunities more low touch, so that this is somewhat like creating events that allow students to gain exposure, so that they're not, working too hard on their end to do that, so that we are showing up in person to expose them to various careers. But the challenge is going to be balancing that with our high touch opportunities, such as the summer internship that we've done in the past, and then also some of the work that Health and Medicine does in one of our different program areas. We expressed a desire for a more centralized, standardized resource. This does resemble the inventory that April was talking about. There was an inventory of pathways. It's now been taken over by Rapid Illinois, produced by the UIC School of Public Health. Additionally, we want to expand that inventory and decimate it more thoughtfully. One thing that came up in the meeting that was interesting to me, but a really great point, is doing the work to assure employers that investing in youth is an investment in their community. And this was really phrased a lot as sort of assuring them that jumping on board with our work it is worth it, in a sense that, we want to create materials and resources that really get them to see the payoff in this delayed gratification of investing in youth, and getting employers to understand that this is a long-term project of investing in our youth. And then additionally, we want to do the work to meaningfully connect the youth that we're working with to training opportunities, employment opportunities, and we want them to see and experience the pathways that will be working to expose them to. So all of this is really exciting to me. I really loved being in the meeting last week, and I loved hearing from the committee what we'd like to do. So we are in the process of scheduling our January meeting so that we can create action plans for this, for these strategies, and then also we are working to clarify our mission and values for the Youth Pathways Committee. And so that's some of the work that we'll be doing in January. But I would love to see more people at the table. And so please reach out to me if you would like to become a part of this. I'll drop my email in the chat. And if you have any questions, please email me. I'm totally open. I love to talk about this stuff, and I would love to hear from any and all of you about the Youth Pathways Committee. So I'll drop my email in the chat right now.
Thanks so much, Matt. So happy to have you on board, and for this committee to have an opportunity to expand and to clarify its mission and goals for the next year. So please, anyone who has an interest in that topic, reach out to Matt so you can get invited to that January meeting.
Yes, please do. Thanks, April.
Thanks, Matt. And, oh, no, not community announcements yet. It'll come towards the end. Now we're going to hear from the Good Jobs Challenge. Sasha Angtanko, Pathways Program Coordinator.
Hi, everyone. Good morning. I'm Sasha Angtanko, Pathway Programs Coordinator, as April shared, for the Chicagoland Healthcare Workforce Collaborative. Similar to Matt, I'm focused on implementation of the Good Jobs Challenge grant within the Chicagoland Healthcare Workforce Collaborative. And we're really excited, and in past meetings, as you've heard, we're really excited to launch the hub model, and you'll see on your screen our Good Jobs Nursing Assistant Pathway Programs Hub. We are moving onward and upward with implementing the hub itself, but the programs within. And so you'll see we have 5 hospital systems represented, all of whom are active within the CHWC. And within all these hospital systems, there were existing CNA programs or PCT programs that are now going to be sustained and or revived by funding from Good Jobs. The focus and the differentiation by being a part of the hub is that every hospital system that you see here, so Loyola, Rush, UI Health, Lurie's, University of Chicago Medicine, and you will also hear from Rush, they are all committed to the advancement, the training and preparation of CNAs, but also their advancement. And so on my next slide here, you'll see where we are at. Of these 5 hospital systems, you'll see there are multiple partners with whom each of these systems is working with for the educational and classroom training. What's great about what we wanted to do is really focus on the learning among the different programs and among the different hospital systems collaborating, hence the hub model. And so even though there are unique programs that were either established, we've asked and informed all of the hospital systems to retain their program models, work with their preferred partners. So you'll see Loyola is planning on working with Oak Point, and Robert H. Lurie Children's Hospital of Chicago is looking at working and partnering with Tugendorf Training Institute, as well as Malcolm X, who has a 16-week part-time program. Oak Point has a 5-week full-time program. Same with UI Health, looking at multiple partners in hopes of being able to better accommodate the needs of different community members and incumbent workers, given the unique structure that that both Tugendorf and Malcolm X offer in terms of formatting and scheduling. University of Chicago Medicine is partnering with Skill for Chicagoland's Future for supportive services and recruitment. And then Rush, we'll hear in a bit, has their PCT apprenticeship. What's great about all these programs is that many of the employers are hiring, several of these employers hire their PCTs or their CNAs up front, often at an apprenticeship or at a trainee level. And then once completing the program and getting their certification, they're able to go, they're continuing to work full time with benefits at the full rate. So that's pretty common amongst, Rush does that, Loyola does that, and University of Chicago Health, as well as Lurie and UI Health are all looking at either ways to guarantee an interview or dedicated job placement opportunities with the partners involved. All programs are offering supportive services in a variety of ways, either through external partnership or through some innovations like a flex fund, which is just an allowance for each participant to use as needed on the things that they would most benefit from versus prescribing what they are able to use funds on. And then an important component as well is career exploration. While all these CNA and PCT programs or nursing assistant programs are entry level, we are truly dedicated through the Good Jobs Challenge funds to ensure that there is intentional planning, preparation, and ideally the opportunity to bring in other individuals within each hospital system to look at next step opportunities, support goal planning, and expose those nursing assistants to their options, utilizing the skills, interests that they gain and learn about within themselves during training, and then connect them to those programs with support elsewhere in their system, either on a nursing pathway or across other types of departments. And so what we're really excited to talk about today, and I want to invite Jacqueline Seawalk to join us on screen. I want to go into we'll talk about the PCT apprenticeship program, and then I'll briefly, but I'll kind of turn it over to Jackie. In a conversation, we'll start to just learn about this really innovative pathway program. In terms of pathway programming and upskilling, because there have been some budgetary changes with the Good Jobs Challenge grant, we're working to understand what funds we'll have in year two because we're completing year one, we're about to enter year two of implementations, technically year three, when we were going to focus on upskilling. We're understanding what funds will look like. For now, Rush is the one hospital system with the pathway program, hoping to fund the other upskilling programs that are in development amongst the other four hospital systems. There were also two other hospital systems that we were looking forward to bring on, Northwestern and Advocate. And so at this time, while on pause, we'll see where things might go. But the state of the grant currently has created an opportunity to get innovative and partner even further on how we can support upskilling through additional fundraising and activating other pools of philanthropic spaces and public funding to make that happen. But now I will turn it over. We get to hear about Rush's assistive personnel to registered nursing pathway program. Jackie, I would love to just welcome you on and have you introduce yourself and just let us know a little bit more about really what prompted the development of this pathway program, this PCT pathway program.
Yeah. Hi. I had to join from my phone. Can you guys see and hear me? Maybe not.
Yeah,
We can.
nope, it's good.
Oh, okay. All right. Because it's so tiny. Sorry. I'm Jackie Swick. I'm the Director of Performance Improvement and Innovation at Rush University Medical Center within the Department of Nursing. So we're so excited to work with Sasha and her team on two programs, actually. And one is our PCT Apprentice, which is an evolution of previous programs. And like Sasha said, this one is novel because we bring them in as apprentices. They have full-time continuous employment whilst they go through the program, wraparound support, and then we transfer them into PCT roles. So they're guaranteed that position. And I'm so excited because I just found out We started with 10, we had 9, and so far everyone who's taken their state boards has passed. I'm waiting to hear about one today, so we're so excited about our success rate for this one. We have a new educational partner, Oak Point, and it's been great. It's been a game changer. Highly recommend Oak Point to anybody else. But the newest program is Assistive Personnel to Registered Nurse. And again, we're so happy to have the grant funding to let us do this. This has always been a long time goal of Rush's, and I think it just took someone to kind of start doing it, right? You always just have to get that ball rolling. And Good Jobs really gave us the opportunity for that. So I'm so excited. It started as a assistive personnel to ADN, but now we've also brought UIC on. So it's actually dual enrollment in their bachelor's program. So if you, right, so it's a partnership with UIC and Malcolm, dual enrollment. Participants will maintain continuous employment at Rush. They are able to drop part-time. It's a very arduous program. The time commitment is 8 to 12 years, and that includes a clawback. The ADN portion is grant funded. Rush is paying for the bachelor's program. So you'll have to work as 2 years as a nurse. So I think that this is the most helpful graphic. It shows the swim lanes for the education and as well for the bachelor's program. So the first 5 semesters is the Malcolm X ADN program. That's very rigid on site, during which they'll work as a PCT or an MA or in their other assistive personnel role. When they graduate, they'll transfer to an ADN RN position at Rush, which is very unique because, as a magnet institution, we generally don't hire associate's degree prepared nurses. But with this program, they'll be getting their bachelor's degree. So they'll have up to 6 years to get it. And the perfect thing with the dual enrollment is they can actually start taking bachelor's degree courses while they're at Malcolm. And they can do that at the Malcolm tuition rate. So it's a cost savings to Rush as well. So people can finish this much sooner. You can do that bachelor's completion in as little as 2 years, especially if you're coming in with transfer credit, so you're very industrious. And you take more of those bachelor's courses during the ADN program. Once you successfully complete the bachelor's program, the clawback is 2 years to work full-time as a staff nurse at Rush. We have a very arduous application process, which I'm going through now, which requires, attestation from the unit director supporting the applicant's participation, letter of professional reference. It's mandatory info session attendance. So I actually set it up so everybody would have to enroll online, actively seek it out, and show up and really making sure that we get engaged participants. We have funding for 20 spots, but I'm actually going to recruit 30 because I know there's going to be some attrition. Some may get into city colleges, but not the nursing program. Some may not pass that TES exam. And I want to make sure that we have all 20 spots. I think that's it. That's the elevator speech.
I'll show this final slide just so it better depicts some of the enrollment requirements and things that you just touched on, Jackie. But while I leave this up on screen, so our audience can take a look, and again, feel free to drop questions in the chat as you continue to hear from Jackie about the program. But something else I wanted to ask you more about, Jackie, because this pathway programming, as we even just saw on the recent poll that we did together at this earlier in this meeting, spoke to a desire in wanting to really learn from one another or hear about strategies for launching these pathway programs as a way to be able to focus on job quality, do more as an employer. And that's not always easy, right? So I'm curious to know what worked well for you to get this program off the ground, getting internal buy-in or in terms of knowing who to partner with. What worked well as you were going through this to get to the program to this?
Yeah, I'm very lucky. One of the things I love about Rush is we really walk the walk with our anchor mission here. Getting buy-in was the easiest part. We're committed to developing the West Side. I mean, here we use local West Side vendors in our cafeteria, local restaurants and things like that. So getting everybody's buy-in and support was the easy part. Proving the ROI is always more challenging. You know, everybody believes in the program. It has to be fiscally viable. And getting the grant funding really helped me sell that because it's paying for half of the whole program, which was great. And UIC is very economical. So the biggest challenge was the time frame, which made legal and finance very nervous because we don't know what's going to happen in 8 to 11 years, of course, but every facility needs to have a retention policy, not just a recruitment policy. And the way I sold that is we're going to be retaining them for 8 to 11 years. And when you think about the cost spread out over 10 years, it ends up being $3,000 a year to Rush, which is, not much.
Mm-hmm. And I'm like having that right front and center. I imagine when you were presenting the slide deck to leadership made that very clear. And I guess with a couple minutes, we actually have some more time. But I'm going to take the screen off so we can just see one another. But in terms, Jackie, of like advice, I guess you would recommend to not only I'm sure I know there are other hospital systems in our hub who are working right now to get their upskilling programs, like they're planning them, we're working on understanding the funding behind that, but advice you would give for those who are really looking to see, to be able to do more for the entry-level roles in their hospitals, especially if they're participating in places like the CHWC. But what would you want them to know about your experience and being able to get this off the ground?
Yeah, I think one of the main things is looking for those unknown roles, right? My background is medicine, not OR. And what I learned is there's a ton of entry-level positions in OR and PACU that require a CNA or just require on-the-job training, right? These can be a great portal of entry for folks, even if it's maybe not directly patient care, it gets them into the hospital. The same there's, with OB and L&D, there's a lot of support roles there. So I tried to wrap that in with these programs, but also hoping to start another program where we kind of like turn the light on some of those and can recruit and let people know the other benefits, education benefits Rush has. One of the other things is really make the interview and application process harder than you think it needs to be. Really vet your candidates and make sure you're picking people who will, be successful, but also your targeted population, which is a very delicate balance, right? And I have a lot of wraparound support, teaching those soft skills. But what I really learned is people need to be open to getting that education and taking that feedback. If there's not, you have to be able to gain the trust of your participants, because I've noticed there's a lot of lack of trust and authority in institutions in general. So trying to pick the people that will be successful and are open to change, a new perspective, I suppose.
That's really great, Jackie. And I actually just learned from our breakout, because we happened to be paired in breakouts earlier, that you yourself started out as a PCT and are now a director of your own department working on these. And I mean, even reflecting on your own experience, can you think of one or two things that really supported your journey? Because I feel like it's talking to those who've made the trek and the journey themselves that we can learn a lot from. And maybe that's something we do in a future community a practice or a future peer learning event.
Boy. Sure. I mean, I think one of the main things that helped me was, because before I was even a PCT or I was in school, it was a lot of support from my employer. I actually worked at a factory, which is a whole nother story. But they were really nice. And they're like, okay, well, you can work for 2 hours, go to class, come back, work for 2 hours. Oh, are you hungry? Here's some pizza. So really that flexibility. And then even when I was a PCT, my employers knew I was in nursing school, and really having that flexibility just so that I could do both was personally really helpful to me.
Mm-hmm. Definitely. And we know that we've heard that for those April mentioned the report that came out on like just different perceptions of entry-level healthcare workers and career advancement, and kind of mirroring that within our hub. We are doing a community of practice. So we meet monthly with the hospital systems. And as we begin to enroll the training partners, educational partners, they'll join us in our monthly community of practice. But we also look forward in our Good Jobs community of practice to invite alumni, and in the formation of an alumni consultant group that I'm excited to build with representatives of PCTs, nursing assistants from these training programs who are currently working, they're incumbent, and learning from them, hearing from their experience, and co-creating with them different interventions that could hopefully benefit the other CNAs who experience the challenges of being able to invest in their education and look at better understand the barriers that they are facing. And so really raising the voices of the employee is important to us in this project in the hub, and being able to hear stories like I know that it's been done, like we've heard with Jackie, is something that we're really excited about with the hub and the pathway programs. So a lot of cool features, a lot of great developments with where we're at so far. Anyone has any questions for me about the hub, for Jackie, about the PCT or assistive personnel to ADN and BSN program? I think we have like 2, 3, we'll go to 9:50. I think we can go. And so feel free to come off mute or raise your hand or questions in the chat. All right.
Someone has to have a question. Come on, just come off mute.
I do appreciate, I think it's Asia's comment in the chat about retention costs with health equity, workforce well-being being a hot topic. And I definitely would agree with that. So being able to tie those two into an ROI or into a business case when you're trying to present this to leadership is definitely, I think, a great way to get some buy-in.
I have a quick question. So the folks who are participating, are they already working in that entry-level role, or are you doing active recruiting in local high schools? Are you open to finding alternative candidates from throughout the city? Can you talk a little bit about that, Jackie? It's such a cool program.
Yeah. For our apprentice program, it's open to everybody. We had a mix of external brand new high school graduates, people from the community, and we had a couple internal transfers from things like EBS. For assistive personnel to RN, it is Rush employees. They need to be here for a minimum of 6 months so that they get some of the tuition benefits for a couple of the other pieces. But for right now, it's just internal employees.
Thanks.
I think, and just in closing, I think the buy-in piece from the participants, from your incumbent workers for this program was something that I appreciate that you really had top of mind, Jackie. And I think it probably plays an important role that you yourself went through this experience of advancing and getting to where you are. And so even, you know, talking about some of the prerequisite courses, there's like a prerequisite semester that a lot of that folks might need to spend time before actually enrolling in the ADN program, and even talking through kind of utilizing that semester and how do we really ascertain like that they have skin in the game and that there is sort of like you know, any sort of fees, knowing that any fees that come up, anything that would sort of deter someone because of that small hoop, felt like the way to screen for commitment, engagement, and sort of the self-initiative characteristic of the participants that we want to see through the program. So we look forward in future quarterly meetings to lift up what we discuss as a nursing assistant pathway programs hub, And similar to what we did in past quarterly meetings where we're engaging the wider audience on different next step positions or different ideas that are related to the hub, or presenting some input outcomes and some, I think, insights from what we're learning and from alumni who come through this program is something we look forward to. So living up to the think tank vision that our steering committee has put forth and we heard about at the top of the call. I'll now turn it back to April. Thank you so much, Jackie.
Yes, thank you, Sasha. And thank you so much, Jackie, for sharing a little bit about the programs at Rush. I'm excited and impressed by a couple of things happening at Rush. One, I love that the program that is bringing PCTs into the role, recruiting from high schools or from the community, is paid. It's an apprenticeship model. I think that's I'm seeing more and more of our hospitals launch that type of model, and I'm really excited about that. And the second thing is the true career pathway building and the long range support that Rush has been able to gain the internal buy-in for. And yes, it's difficult, right? Proving that ROI, saying let's invest in someone for several years. That's tough. So I'm really excited to see how that first cohort does, and hoping that more hospitals will be inspired to try something similar. So with our last 8 minutes, I'm going to open the floor for community announcements. Anything you would like to share with the group? I know we have one exciting announcement, turning it back to Tamar Froelich-Jean-Appel from Upwardly Global. Take it away, Tamar.
Thanks, April. So excited. I know this is a little bit out of the parameters of what a lot of folks are working on, but very relevant, I would say. So Upwardly Global has led a group over the past year and a half to do some advocacy at the state level, and starting during the pandemic, getting a temporary permit. Long story, you can read about it. I just put the link to a wonderful paper that April worked on that my colleague Rebecca Fishman, we're so excited. Anyway, long story short, we're launching this paper, and we want people to know that coming in January of 2025, the state of Illinois will have a limited license, which will mean doctors who've been trained internationally and who have passed all the USMLEs can get a limited license to practice, which is super important because normally to license, they would have to get residencies, and there's simply not enough residency spots. So this paper goes into some details about the organizing we've been involved with, working with a lot of amazing partners, and the upcoming implementation of this new limited license. I'll also throw my email into the chat. Feel free to share. I know most of the folks on this call are not folks who do hiring for MDs and physicians, but if you want to share this with your colleagues, we'd be happy to talk to them. We're also starting in the new year a program to do implementation with an organization called the IMG Academy that did a lot of the leadership of this effort in Washington State. So lots of states are working on this, and would just love to get your feedback on this paper and have conversations if folks are interested. Thanks, April.
Thank you, Tamar. I am so excited to see that paper come out. I was a part of that, and it's very exciting that we're making that progress here in Illinois. Does anyone else have an announcement to share? Feel free to just come off mute.
Okay, well, I'll share. This is Magnolia with the I Am Able Foundation, Dr. Lamenta Conway. Our application for any high school, sophomore and upward, and college students that's wanting to become a medical doctor, and need mentorship, our application will open May 15th. We had tried the 1st, but we'll probably have it open by, not May, December, I'm sorry, December 15th. And it will go until March 15th of next year. So like I say, from sophomore on up until college, we would love for them to apply. Thank you.
Thanks, Magnolia. That's a fantastic program if anyone is involved with students who are aspiring to become MDs. Anyone else? Well, if we don't have any other announcements, I'll give you your 4 minutes back. It's been a great year. Thank you all so much for being a part of CHWC, for being active in these meetings. All the meetings for next year will be up on our website within the next week or so. So look out for those. Thank you all. Happy holidays. Stay warm. Bye.
Bye. Thank you.